Good evening. I'm psychiatrist Jay Fawver, live from the Bruce Haynes studio in Fort Wayne, Indiana. Welcome to Matters of the Mind. Now, in its 28th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720, or if you'd like to text me, you may text me at 260-969-2730. You can text me on the air as I speak. Now, on a fairly regular basis, I am broadcasting every Monday night from our PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. That's mattersofthemind at WFWA.org. And I'll start tonight's program with a question I recently received. It reads, Dear Dr. Fawver, I get the whole seasonal affective disorder thing, but what I'm wondering is if quickly changing weather patterns can have a similar effect. Do a few cold days or rainy days in a row affect someone's mental health? Well, you're referring to barometric changes, actually. Barometric changes will be where the pressure will go up or down, and that gives you cold systems and you get rain and all sorts of weather patterns. That will affect you if you have migraine headaches and if you have arthritis. Not so much for anxiety or depression, to our awareness. Anxiety and depression are more affected by the brightness of the light, especially feeling more depressed. There's a phenomenon, as you mentioned, called seasonal affective disorder, also known as SAD, also known as winter depression, because most people will notice if they have a tendency toward winter depression, they'll feel somewhat more depressed, with lack of energy, more social withdrawal, they want to eat more. That occurs around November, goes into about March. And the reason that occurs is because, looking at the middle of the brain here, eyeballs will receive the brightness of the intensity of the light, and that brightness of the intensity of the light will give a signal to the pineal gland, right smack in the middle of the brain. The pineal gland secretes melatonin, and when it gets darker, day by day, in the mornings and evenings, the melatonin levels will go up, and it's thought that that's contributing primarily to seasonal affective disorder. Women are 8 times more likely to get seasonal affective disorder compared to men, and it's certainly affected by latitude. The higher latitude, the more north you go, the more likely you're going to have seasonal affective disorder. But barometric pressures do not seem to affect the mood or anxiety, outside of being disappointed if it might be raining and you have something to do outside, but won't really affect the mood, as you'll see with other medical conditions like migraines or arthritis. Thanks for your email. Let's go to our first caller. Our first caller is from John. Hello, John. Welcome to Matters of the Mind. John, you had mentioned that your doctor said that you should start taking medications for your anxiety, that your daughter said that the medication will change your personality and you won't be able to feel any emotions. Is that true? John, that's a question I've been hearing for the past 40 years, ever since fluoxetine or Prozac came out in 1987, and it was followed by Zoloft or sertraline, then Paxil or Paroxetine. Then we've had other serotonin medications come out. The serotonin reuptake inhibitors are particularly helpful for dulling the emotions. They give you emotional blunting. Now you'd think, well, gee, why would anybody want to do that? Well, if you're really highly anxious and you have panic attacks, if you're having social anxiety, you worry excessively, if you enhance serotonin, it will dampen down some of the excessive emotions. And in doing so, sometimes you can so-called lose your personality if you get too high of a dosage, and we call it emotional blunting. So when people have emotional blunting, they will just kind of feel dull, and they won't feel happy, they won't feel sad, they'll just kind of feel in the middle. That's what your daughter is referring to. Now, there's different types of medications outside of the serotonin medications for anxiety. Sometimes we use the anti-seizure medications for anxiety, such as gabapentin, also known as Neurontin, and pregabalin, also known as Lyrica. Sometimes people will use oxcarbazepine, called Trileptal. Those are anti-seizure medications that can be used for anxiety. We're trying to get away from the use of benzodiazepines like Xanax, Klonopin, Valium, Ativan. Those are medications that can make you more cognitively adult and give you difficulty thinking and processing information. And yeah, they can be habit forming the longer you take them. So we're trying to get away from those. And of course, there are supplements that can be used with negligible side effects: L-theanine, saffron, and NAC, N-acetylcysteine. Those can sometimes be used with help with anxiety conditions. Inositol is another one. That's a B vitamin supplement. So inositol, NAC, saffron, and L-theanine are the main medications we'll hear about as supplements to use for anxiety with negligible side effects for most people. John, thanks for your call. Let's go to our next text message. We have Erica from Marion, Indiana. Welcome to Matters of the Mind. Erica, you had asked, why do some antidepressant medications cause suicidal thoughts if it's for depression? Erica, what happened 25 years ago? There was a big study done on children and adolescents and young adults up to 24 years of age. And they looked at the serotonin medications and the serotonin norepinephrine reuptake medications, and they found that a couple of them, particularly Effexor and Paxil, caused more of a likelihood of causing suicidal thoughts and behaviors compared to placebo or sugar pill. This is 25 years ago. Well, it turns out that Effexor and paroxetine have kind of funky metabolism. Effexor gets out of your system really fast because it's only about 35% protein bound, so it doesn't hang on to the protein very long. Paroxetine or Paxil, it inhibits its own metabolism, so when you stop Paxil or paroxetine, it gets out of your system real fast because it's no longer inhibiting its own metabolism. So with that in mind, those two medications were the main culprits that in some cases would increase suicidal thoughts and behaviors. But a further analysis 20 years later on those studies showed that the children, adolescents, and young adults who had the increase in suicidal thoughts and behaviors had specifically difficulty with racing thoughts, decreased need for sleep, increased impulsivity, symptoms that we would now call bipolar disorder. We wouldn't put that population on an antidepressant by itself anyway. So with that being said, if you have a person who has mood swings and bipolar disorder symptoms, we need them on a mood stabilizer, not just an antidepressant. If you put those people on an antidepressant medication, they're more likely to get more moody, more irritable, more impulsive. So the key recommendations now will be, if you start somebody on an antidepressant, keep an eye on them the first couple weeks and make sure they're not feeling worse. If they feel worse, you might have misdiagnosed them, and they might not just have depression, they might have actually bipolar disorder. But those black box warnings, those boxed warnings, remain on all antidepressant medications, warning that if a child, adolescent, or young adult patient takes an antidepressant, they can have increased suicidal thinking or behavior. Okay, they can. It's just that the actual studies demonstrated that it was a slight increase versus placebo, and it was particularly for those people who had more moodiness that we would now consider to be bipolar disorder. So it's a fine nuance in that regard. Speaking of suicidal thinking, the medication of all medications that seems to increase suicidal thinking the most will be the benzodiazepine medications. They can increase suicidal thoughts by 4 times compared to many other antidepressant medications. So if you take Xanax, Klonopin, Valium, and Ativan, yeah, it might chill you out for a while, it may give you more of a calming effect, but those medications are much more likely to increase suicidal completion compared to other medications. The medications that actually drastically decrease suicidal thinking, interestingly enough, will be antidepressants to some degree, but even more so lithium. Esketamine, also known as Spravato, is another one. Klonopin or clonazepam has been known for a long time to have anti-suicidal features. There's another Klonopin or clozapine. Clonazepam is a medication that is also known as Clozaril. That decreases suicidal thinking. And olanzapine, also known as Zyprexa, can decrease suicidal thinking. So there are certain medications that can be used specifically to decrease suicidal thinking. Lithium's been around for a long time. Lithium came out for mood stabilization way back in 1949, and it has this effect on the brain where it can decrease inflammation specifically in the brain. So lithium, it's a salt from the ground, it can decrease suicidal thinking by decreasing inflammation in the brain, even for somebody who doesn't have bipolar disorder. So low doses of lithium have been shown to be very helpful for people having suicidal thoughts. And we'll often use lithium at 150 milligrams every day just for the purpose of helping somebody with these recurrent obsessive suicidal thoughts, and often we'll see results within a week or so. Some people, by nature of their obsessions, will have obsessions about harming themselves, and if that's the case, we can give a small dosage of lithium to try to help that out. Thanks for your text. Let's go to our next caller. Hello, Ben. Welcome to Matters of the Mind. Ben, you want to know, how do you know if relationship stress is affecting your mental health? Is there any healthy way to set boundaries in a relationship? A relationship, Ben, whether it be with someone of an opposite sex, whether it be a romantic relationship, whether it be a friendship, should be a reciprocal type of relationship, Ben. So here's how it works. It should be a give and take relationship, and that relationship with whom you're involved should actually bring out your attributes and not cause you to feel worse about yourself or make you feel as if you're having a detrimental encounter every time you meet with this person. So a relationship, if it's a healthy relationship, should bring out your strengths and actually make you a better person. So it's kind of a give and take in that regard. If you're having an unhealthy relationship, even to the point of it being an abusive relationship, you need to be aware that if that type of relationship is causing you to feel anxious and depressed every time you're encountering that person, you got to kind of step back and wonder why you're still involved in that relationship. Again, whether it's a romantic relationship or a friendship. If it's a family member, okay, you do still have to deal with family members, but with family members, I would certainly encourage people to try to work out that issue, because family is something that is constant. I don't recommend, as was very popular 25 years ago, that you just entirely diss your family members and you don't have any contact with them. I think you still need to work things out and try to get some resolution there. But if it's a friendship or a relationship that is not something that is permanent, and it doesn't need to be, you need to ask yourself if you still want to be in that relationship. But again, it should be a give and take. You should not be a therapist to your relationship with whom you're involved. It should be reciprocal, where you feel like you're getting something out of that relationship as well. Thanks for your call. Let's go to our next caller. Hello, Bill. Welcome to Matters of the Mind. Bill, unfortunately, you said your wife died recently. I'm sorry to hear that. You were married for 57 years, and you're having a hard time with the death. What are the things that you can do to help you mourn her death? Bill, the first thing you do is try to make sure you're getting some sleep. Keep in contact with your primary care clinician to make sure that your health is staying intact. It's very common, Bill, within 6 months of a spouse's loss, especially if you've been married for over 57 years, it's very common to literally die of a broken heart. And the way that happens, it's a cardiac arrhythmia. The cardiac system has a elaborate electrical system tied into it, and that electrical system, due to the thought of a broken heart, it's called broken heart syndrome, you can have an aberration or an abnormality of that electrical system, and your heart kind of flutters and you can die that way. So the first thing you want to do, Bill, is make sure you're still getting your sleep. Many people after the loss of a spouse don't get their sleep, and lack of sleep not only affects you from a mental health standpoint, but can significantly affect you physically, and it can be very detrimental on the body. Secondly, try to get outside every now and then. Don't stay in the house any more than you need to. If you've never walked the neighborhood or walked in your area before, this is a good time to start walking. Walking and getting fresh air is fantastic for your mental health at any time, but especially when you're mourning a loss. Getting outside the house, and expect to feel sad, expect to have crying episodes, expect to have that empty feeling inside. That's going to happen. It's going to be a punch in the gut after you lose your wife, as you've described. But try to get outside and do some physical activity. Take it a notch further. Try to be around people socially. This would be a good time to maybe rekindle some social relationships you might have passed by over the course of time. You'd mentioned you've been married 57 years. I imagine you might be retired. If you're retired, okay, try to get involved with some social relationships, because retiring often will socially isolate people anyway. If you're still working in some capacity, that is fantastic. It gives you purpose and meaning and something to do. If you're not employed, yeah, you want to rekindle the social relationships, but if you're not employed, you want to have some kind of purposeful, meaningful activity on a day-to-day basis. You need to have something to do, and that can be having an exercise routine where you go to a health club, where you play pickleball or whatever you want to end up doing, because that gets you around other people, but it also helps you physically. Try to maintain some kind of meal schedule, because if your meals were kind of lacking over the course of time, this is a good time to try to figure out on a regular basis what you're going to eat proactively. Don't impulsively eat fast food or find something very quickly. Have kind of a meal plan set out for you for the next week, week by week by week, because many people, when they're grieving the loss of a spouse, they don't eat properly. And that's why many caring individuals in a church community or a social community will bring by food when somebody's grieving, because often when you're grieving, preparing meals will be the last thing that you consider. So there are a lot of different things you can do, but keep in contact with your primary care doctor to keep an eye on your overall health. Thanks for your call. I wish you well. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, my mother has been diagnosed with depression and has given up on a lot of her usual activities. I don't want to see her take a medication, but she's refusing to watch her diet, exercise, or get good sleep. What are her options? Well, again, going back to not watching her diet, not being physically active, not exercising. It happens with depression quite commonly. There's a part of the brain in the middle part of the brain, it's called the anterior cingulate gyrus, that's malfunctioning when people get depressed. And it gets to the point where they have difficulty with enjoying things. And that middle part of the brain, called the anterior cingulate gyrus, is right up here. And it gives you a sense of personal awareness, and you'll have trouble enjoying things. Lack of enjoyment in usual activities will be a key factor for somebody getting depressed and staying depressed. So if your mother is kind of giving up on life and not enjoying things, that's called anhedonia. An means no, and hedonia means fun. And it's a key symptom of depression that needs to be addressed as soon as possible. So when somebody has depression, it sounds easy. Gee, you just need to get off the couch. You need to exercise. You need to eat properly. You need to sleep. Telling somebody to do that is kind of like telling somebody who's had a recent heart attack that they need to get physically active and prepare to run a 5K over the next few months. It's probably not going to happen. Their heart isn't physically strong enough to do so. So with cardiac rehabilitation, that's often what is attempted. Not only are you trying to get more physically active, you're trying to get the heart stronger, you're trying to get a better diet overall. With cardiac rehabilitation, sleep is a key component to that, but you can't just say somebody, just do it, because the heart's not strong enough to initiate that. Sometimes with heart rehabilitation, it also involves taking medications for the purposes of improving blood pressure and making the heart physically pound stronger. We do that with depression. What we're trying to do with depression is sometimes offer somebody an antidepressant medication to get them out of the funk, to fire up certain networks in the brain, to allow them to be able to enjoy things but more, have more energy, have more motivation in a natural way. We're not talking about stimulants when we treat depression. We're talking about medication that can specifically affect key neurotransmitters. Glutamate is a key neurotransmitter that has been discussed, and we've utilized that in treatment for the past 2-3 years. But over the past 6 decades, we've used medications that primarily affect serotonin, norepinephrine, and dopamine. And those kind of neurotransmitters in various ways can help people with depression. How long should she need to be on it? Well, usually the rule of thumb is she'd need to be on the medication on a regular basis for about a year. After that, you look at the pros and cons of staying on the medication. But what you don't want to have see your mother do is continue to deteriorate, because with persistent depression, it can affect a person physically as well as mentally. Physically, it can affect you with more heart conditions. You have an increased risk for stroke, increased risk for diabetes, increased risk for obesity. With ongoing depression, you actually have a higher cancer risk and osteoporosis risk, where the bones start thinning. Depression can deteriorate the entire physical functioning of the body, so you want to try to get that under control as soon as possible. So keep in contact, starting with the primary care clinician. If the primary care clinician is able to refer your mother to a mental health specialist, that's always in her best interest as well. Well, thanks for your email. Let's go to our next caller. Hello, Rosa. Welcome to Matters of Mind. Rosa, you had asked if you're feeling having an extreme feeling about something, isn't there a reason? Shouldn't we listen to the signs of our body instead of trying to suppress it with medications? Should I really consider taking medications? It depends what that extreme feeling might be, Rosa. If the extreme feeling is compelling you to do something that would be constructive, that's fantastic. But if you have an extreme feeling that you want to buy 3 automobiles and 2 houses, that could be that you're having a manic episode. So it all comes down to, gee, do I take a medication for how I'm feeling or not? It comes down to what's called functional impairment. Functional impairment is when you're having a mood or a cognitive disturbance, that being a thinking disturbance, that's influencing you in such a way that it's not in your best interest. So if you are having trouble socializing, going to work, being around other people, doing things you need to do on a day-to-day basis, and it's being influenced by your mood or cognitive disturbance, well, that's where medication can be helped out. So if you're having an extreme feeling, if you're having a thought about this or that, and that thought is not propelling you into a type of behavior that would be in your best interest, that's where it can be detrimental for you, Rosa. So I'd say, yeah, you can always talk that over. Again, going back to the primary care clinician, talking over with the mental health clinician you might be seeing, and try to sort out, okay, is this feeling something that I should be motivated to carry out, or is it not so much in my best interest? Thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, are there different types of anxiety? Are they treated differently, and how do you know which one you have? There are different types of anxiety. There's an anxiety that goes along with depression. It's called depression with anxious distress. Major depression with anxious distress is where you have depressed mood, and then you feel tense, you ruminate, you're anxious about things, you have trouble sleeping, you're nervous all the time. But it's predominantly going along with the depression itself. You treat that kind of phenomenon primarily with an antidepressant that would also address anxiety. Another type of anxiety would be called obsessive compulsive disorder. Obsessions are unwanted thoughts that you just can't get off your mind, and compulsions are unwanted behaviors where you do something over and over and over again even though you don't want to do so. OCD is an anxiety disturbance that's primarily treated with medications at high levels that increase transmission of serotonin, and they stimulate this particular receptor called sigma-1 receptors in the neurons. Sigma-1 receptors will modulate inflammation and the transmission of serotonin, norepinephrine, and dopamine. Those medications would include high doses of Luvox, also known as fluvoxamine, and sertraline, also known as Zoloft. So those are that's another type of anxious diagnosis we'll have. We'll hear about panic disorder. Panic disorder is where people will have difficulty with unprovoked extreme anxiety surging within 10 minutes, where they have a fast heart rate, they're shaky, they have gastrointestinal problems, they feel hot or cold, they feel like they're dizzy, they feel like they're going to die, and it gives them this surge of anxiety. It's a miserable feeling to have, and it'll occur when they're in certain situations initially where they feel like they're back up into a corner. It's a fight or flight phenomenon. Initially, we might give those patients very carefully a benzodiazepine, but more often than not, if it's an ongoing difficulty, we'll give them the possibility of a serotonin medication or maybe a anti-epileptic medication like gabapentin. So that's a third type of anxiety. So you have major depression with anxious distress, OCD, and panic disorder. Another type of anxiety would be social anxiety disorder. Very, very common. Social anxiety is where you feel unnaturally anxious in the presence of other people. Now, everybody should have social anxiety, especially going back to adolescence. In adolescence, that's when people should have severe social anxiety because you're learning how to socialize. So you should feel anxious in social situations. You learn how to cope with those interactions. You practice, you develop skills in socializing as an adolescent. That's all good. But over the course of time, people will find that social anxiety disturbance can be a problem going into the adult years. Unfortunately, many adults will drink alcohol as a means of self-medicating the social anxiety. They go into a social gathering. The first thing they do is go to the bar and get a drink. Other people, especially as we go into the 21st century, will use cannabis products. They'll use marijuana, and especially if you start using marijuana during those very, very important adolescent years when you're trying to develop social skills. Marijuana will actually stunt your ability to develop social skills. So here you are, if you're still smoking marijuana in the 30s, you still haven't socially developed. So social anxiety is very prominent for a lot of people. Post-traumatic stress disorder, PTSD, where people have encountered a very severe trauma, sexual abuse, physical abuse, motor vehicle accident, combat trauma. People with PTSD will have the type of anxiety where the trauma will evoke later on memories, and they'll feel jumpy, and we call it hypervigilant. They're always on guard. They'll have nightmares. They'll avoid situations or sensory input that reminds them of the past traumatic experiences. Post-traumatic stress disorder will often be treated with psychotherapy, and sometimes will be treated with blood pressure medications like prazosin, guanfacine, clonidine, and we'll often use serotonin medications for that as well. A particular kind of therapy that's good for a PTSD will be eye movement and desensitization reprocessing. EMDR will be very helpful from that perspective. Another type of anxiety people sometimes will encounter will be phobias, where they're afraid and fearful of a particular thing. And the phobias can be very problematic for some people, where they're afraid of encountering a certain thing that might have given them unnatural type of anxiety from the past. So those are lots of different type of anxiety disorders. Yeah, you need to get diagnosed with the proper one, because based on the diagnosis of what kind of anxiety you're experiencing, we're going to use particular treatment to address that. Thanks for your email. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues, you can write me via the internet at Matters of the Mind, all one word, at WFWA.org. I'm psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
The preceding program on PBS Fort Wayne is made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronHealth.com.